Hello guys, today we are going to discuss about a blood test. The name of the test is blood culture. When a person has a sign or symptoms of a species like fever, chills, feeling sick, confusion, and tiredness, which may develop during another illness such as urinary tract infection, pneumonia, or skin infection, this test may be asked. Blood cultures are performed to detect and identify bacteria and yeast, a type of fungus, in the blood. Infections of the bloodstream are caused most commonly by bacteria. It is called bacteremia, but can also be caused by fungus, fungemia, or a virus sometimes, viremia. The source of the infection is typically a specific site within the body. If the immune defense and white blood cells cannot keep the infection localized at its source, it may spread to the bloodstream. When the body has an excessive response to this, causing damage to the organ of the body and stopping them functioning properly, this is known as a sepsis. If the sepsis also causes reduced blood flow through the organ of the body, this is referred to as septic shock, which is a serious, overwhelming, and often fatal illness. Blood cultures are also important in the diagnosis of several other conditions. Endocarditis, an inflammation and infection of the lining of the heart or the heart valves, can result from a bloodstream infection. People who have artificial heart valves or artificial joints have a higher risk of infection following surgery. Although these infections are not common, the direct contamination of the blood from dirty needles with intravenous drug use or potentially from the intravenous catheter or surgical drains can lead to bloodstream infections. Similarly, anyone with an immune system which is not working properly due to underlying disease, for example, leukemia, HIV, AIDS, drug therapy, for example, immunosuppressive drugs, has a higher chance of bloodstream infection. If your doctor, if your blood culture is positive, the specific bacteria causing the infection will be identified in a laboratory. An antibiotic susceptibility test will be done to tell your doctor which antibiotics will be effective for treatment. If yeast are causing the infection, treatment will be given that is appropriate for the fungal infection. Sample required is blood. Normally, it should be sterile even after incubation at appropriate temperature for a certain period. That's all for about that.